Okay, so, hello, good morning. My name is Joseph Tenenbaum, and for my senior seminar, I spent 80 plus hours with Dr. Chilson and his staff. Imagine this. I bet that everyone in here has had dental work done on their teeth, or had a cavity or a chipped tooth. If you went to get those replaced or fixed, you'd have to go to a dentist office. First, you would wait in the waiting room. We would get you examined in the exam room, and then we would fix the problem. So the description of my internship. My internship consisted of 3.5 weeks of working alongside and observing Dr. Tilson and his partner, Dr. Flintz, along with his staff. Also, I did 20 plus research hours. My on-site advisor is Dr. Jeffrey Tilson. He graduated from Miami University for his undergraduate, and he obtained his dental degree from The Ohio State University. Also, he spent 2 years in California with the Navy. So why I chose to intern with a dentist. So as it says up here, there are many dentists on my mom's side of the family. My uncle's a dentist, his wife, my aunt, is a hygienist. They have 3 kids, 2 are dentists, one's a dental hygienist, and then who is married to a pediatric dentist. So there's a lot of dentists in my family, which makes me like it a lot. I love taking care of my teeth, I love a great smile, and I hope to be a dentist one day. So my internship details. I interned with Dr. Tilson and his staff from July 14th to August 5th, 8 hours every day. So what I did while I was there was I watched Dr. Tilson interact and treat patients. I also observed in the back there's a lab. Hygienists were making molds and developing x-rays, and then Dr. Tilson and I would later observe the x-rays. Some things I really enjoyed. I saw 3 implants. And this is really unique because Dr. Tilson said he usually gets 1 to 2 implants every 3 months. So in my 3.5 week span that I was there, I got to see 3 implants, which was huge. I loved helping Dr. Tilson with new technology because there's always new things coming out, and he has to learn how to use them as well. I really enjoyed mixing glue for crowns because if Dr. Tilson had a tool in someone's mouth and his other hand was getting a tool off of his desk, I could just mix it for him and I could just hand it to him and it made everything like so much easier. I really enjoyed setting up and cleaning rooms because I could do this independently. I would disinfect everything and I'd put plastic covers over all of it so that for the next patient everything was clean. Also with cleaning tools, I would separate all of them and I would put them into an ultrasonic autoclave, which is a machine that will sterilize all the tools so they can keep reusing them. Also, I really enjoyed wearing the gloves and smock. The gloves are up there. I really enjoyed that because I felt like I was a dentist, and people asked me, is this your residency, where did you go to college? So I felt like I was all grown up. Some information that I learned, how to talk to people, that was really important. A lot about fixing teeth. Time management. With time management, you want to spend enough time with the patient to establish a relationship, but you also need to know that you have a patient in another room that needs your help as well. I learned a lot about root canals, anesthetics, implants, and bridges. Those are the main things that we looked at a lot. So the first thing people ask is, like what Dr. Tilson says, we're going to have to perform a root canal, is what is a root canal? A root canal, as you can see in the picture up there, is when the pulp of the tooth is infected and it needs to be replaced. So pretty much what we would do first is x-ray your tooth to see how many roots are in the tooth. In a baby tooth, there's 1. You never do a root canal in a baby tooth because it would just fall out. But on an adult tooth, there'd usually be 2 to 3 roots. So first you would drill open the canal, drill open the top of the tooth, and you'd have to find how many canals there are. You'd have to file down the canals, as you can see up there in the 3rd picture. Then you'd have to remove the infected pulp, and then we would have to use Clorox, which just cleans the tooth, so it's like not infected anymore, I guess. It's much cleaner. And then we put a material called Gouda Percha in, which is the tooth like really likes in it, that helps it be stable. And then we would refill the tooth, and then we would crown it, and then we would use carbon paper. It would show like you would bite onto it, and it would show like where there's pressure points, and you shave down the pressure points so it doesn't affect your bite at all. Another big thing was Novocaine, and Novocaine is used to suppress pain in a certain area. So the positives of Novocaine is that it is obviously only used to suppress a little area and not numb your whole mouth, or your whole face for that matter. But if you do miss, if you go into the sinus and it could bruise your whole face. One thing that some patients did use was nitrous oxide, which is laughing gas. There was no shot, like if they had anxiety and didn't like needles, we could give them laughing gas, but again, it would numb their whole face and they'd probably been eating for a couple hours. For my preliminary research, I searched on how to become a dentist, and many things that are helpful in how to become a dentist. You want to have a strong chemistry, math, physics, and biology background, so a lot of science. Also, some information that I learned during my preliminary research is that a first-year dentist, on average, usually earns about $168,000 from the ADA. And then also, if you want to become a specialist, they earn about $315,000 a year. For my literature review, I researched the history of dentistry and ancient dentistry. Unlike today's dentistry, it's based off science. It used to be based off religion. So a priest would be doing your dentistry work instead of a certified doctor. So this is like kind of how it would work. So a priest would do your procedure, and if it worked, he'd get paid, and the gods said that you were worthy. Mm-hmm. But if it didn't get fixed, which I'm sure was a lot, he would say that the gods said you weren't worthy of your fix, and you have to live with like the pain, which is weird. My interview review number 1 was held with Dr. Tilson, my on-site advisor, and Dr. Fleitz, his partner. The essential question was what problems occurred during an examination and how to respond. Well, one thing that happens is people get really nervous. So instead, like, it is used as a numbing agent, but nitrous oxide can also be used to calm people down, and we can also give them more shots that would also numb, but like for a few patients we had to use nitrous oxide to relax them. And then another thing is what type of treatment is best for the patient and their pocketbook. Like, for example, an implant and a bridge, 2 very similar procedures, but an implant is titanium, which is very, very, very expensive, and one is a different, rock hard plastic material, which is a lot less expensive and more affordable. My second interview review was held with Dr. Stephen Lang, he's my uncle, and our essential question was how to plan, prepare, and problem solve during a surgery. One thing he does, which is special, is he has a special room just for surgeries, so it's always ready. There's always tools, and if he ever needs to do like emergency surgery, it's always ready. Like I said with the tools, he uses different tools every time, because if you're cutting into someone's jawbone and there might not a lot of bacteria, but if there's like just a tiny bit of bacteria on the old tools that you use that the autoclave didn't get, and it gets into their jawbone and infects their jawbone, that could be very bad. And also, he tries to avoid any problems. He thinks of problems that could potentially happen in the surgery before he actually does it, so he knows how to problem solve. Another big thing was an implant. Kind of like a picture to put in your heads. An implant is kind of like putting up a deck. You dig a hole, and then you put like a post in, and if you like put in concrete, that would be like the bone that we put in that helps it fuse together, and it's like rock hard, and then it's like universal, and you can put anything on top to build a deck. It's kind of like the same thing here. An implant is very, very, very strong. It lasts much longer than a bridge, but I have heard that I saw a patient that had a bridge last for 60 years, which is kind of impressive, and it's very, very expensive compared to a bridge. So an implant works like this. So a metal titanium rod is placed surgically into your jawbone. The implant, and then you put bone in there as well. Then the implant would fuse with the gum and bone. But the downside is it will take weeks and months for it to all heal together, but the bridge would take like a week and a half or 2. Then once the implant bonds, you put an abutment cap on, which is kind of like a universal connecting piece, and then you could attach the crown, which is the new tooth, and then it'd be just as strong as a tooth because it's all bonded actually with your gum and bones. Reflection, I wish I did a lot more hours with my on-site advisor. I've been in a couple times, but I didn't record it. Also, my life lessons, I learned to be a lot more responsible. I have much better time management. I'm much more professional, and my social skills have increased a lot. My future plans is to become a dentist, and attend a four-year university where I would then go on to dental school. Up here, we have, I couldn't take anybody else's x-rays because it would violate rules. But this is my own personal x-ray. And one thing that's unique is this was right after I got my braces off, and you can see the metal wire that shows up on the x-ray. This is the info pamphlet they gave me, one being Invisalign, one is about dental implants, which is very important, and then one is just the office pamphlet. Two pictures that I thought were really important is one, this is a normal room and it's very open. I would see the plastic, there's plastic covers and there's the disinfecting wipes, and I clean all this off and the lights. And then this room is more secluded. There's actually a door that I took it in the picture from right here, and it's very secluded. That's where we do surgeries. Here are gloves, 2 gloves and a mask. Obviously those aren't the ones I use because that'd be dirty. But that's what I would wear every day with a smock. And then over here is just a baggie that they give you after a normal checkup, which consists of dental floss, toothpaste, and a toothbrush. I'd like to thank Dr. Tilson for being my on-site advisor, and I'd like to thank Dr. Tilson again, Dr. Fleitz and Dr. Lang for being my interviewees, my parents and the senior team for helping me throughout this whole process and editing my papers. Thank you.
So, Joseph, after your internship, what advice do you have for somebody like me that is terrified of the dentist and puts off their cleanings like the plague? Like, tell me what I need to remember. Tell me why it's so important.
Well, it's really important because they say it's actually a fact that if you have more teeth, you'll live longer. So probably go to the dentist is a smart idea. And it's really not as bad as it sounds. Dr. Tilson is really, he likes to talk and he's polite, and he'll make you feel comfortable before you do anything, before he wants to get in your mouth and actually do something. So that's nice.
Do they talk a lot with patients about gum disease and flossing, and don't you think that should be discussed?
They talk about flossing, but they don't want to scare you, kind of. Do you know what I mean?